The Director General, National Agency for Food and Drug Administration and Control, Professor Mosi-Sola Adeyeye, has identified non-compliance with advisory guidelines established by the agency and unwillingness of exporters to comply with minimal sanitary measures as some of the reasons Nigerian food products are rejected in the United Kingdom. The Nafdac boss at Tuesday news briefing in Abuja, however, said it held a scheduled side event with the UK Food Standard Agency to change the narrative and stop the rejection of Nigerian food products in the international market.
To ratify this, and as an outcome of Nafdac recent meeting with Food Safety Agency of UK, Nafdac is commencing on 6 regulatory measure approaches to address the situation. These include immediate inclusion and implementation as a matter of urgency of Nafdac good manufacturing practices, good hygienic practices, and laboratory testings such as mycotoxin testing or level of mycotoxin testing, pesticide residue testing, and heavy metals. And all this needs certification for all our regulated products, be it food, drug, and others by the National Export Supervision Scheme as administered by the PIAs. This is another step in addition to other steps already taken by the DG toward changing the status and narrative of Nigerian food products in the international market. The steps already taken by Nafdac include: 1. Bringing into focus the export oversight functions of the agency by the establishment of Office of Trade and International Relations about 2 years ago. 2. Engagement with other chief executives of trade facilitation related MDAs at roundtable conferences in respect of streamlining Nigerian exports.
In a related development, the federal government says it has secured over 6 million doses of the human papillomavirus vaccine and essential supplies for rollout for girls aged 9 to 14 years. The Executive Director and Chief Executive Officer of the National Primary Health Care Agency, Dr. Faisal Shahab, said the vaccine will help prevent HPV infection and reduce the risk of cervical cancer. HPV is a common sexually transmitted infection that has a silent harbinger of several types of cancers, including cervical cancer.
The introduction of the HPV vaccine is not just a medical advancement, it is a profound leap forward in our mission to protect the health and aspirations of our young girls. It empowers them to lead healthy lives and become the formidable women and mothers of tomorrow. Human papilloma virus is a commonly transmitted infection that is a silent harbinger of several types of cancers, including cervical cancer. Tragically, cervical cancer stands as the second most common cancer among women in Nigeria and the second most common cause of cancer-related fatalities among women aged 15 to 49 years. This is why the introduction of the HPV vaccine is a beacon of hope in our relentless fight against the burden of cervical cancer.